to do that.
Yeah, absolutely.
And you're going to start in what, 2 minutes? Whatever Jen tells you?
I think 10:33.
Okay. Any questions for us?
No, should be ready to roll.
Hey! Come on and rock and roll, okay?
Sounds good, Pete.
And I found your co-presenter. Wandering around drinking coffee.
Yes. Nice.
That's right. So how are you doing? How are things?
I'm good. I'm good.
Good.
You?
Good. Fine. It was great to connect with people through there.
Yes.
So,
Awesome.
for sure. So, but I know, like, officially, I think I'm supposed to kind of be like the timekeeper / support person. So
Perfect.
anything you need, it's like you're all set with your tech. And
Yeah. No, just. Hello. Whoa. Good morning. Sorry to interrupt the networking. I'm a career guy, so I love it. It's awesome. Well, it's good to have the MHA and MPH students here this morning. My name is Darren Kaltved. I go by he, him pronouns. I'm Associate Director for the Office of Career Services for the School of Public Health. I met many of you in the resource fair. And what I'm going to be talking about today, along with a colleague of mine, a great colleague of mine, we're going to talk about your public health career and kind of what does that look like going forward. So without further ado, here's kind of an agenda. We're going to start by what is public health. Now you're probably thinking, Darren, that's why I'm here, right? We know what public health is. But I'm going to talk a little bit about kind of what it is, what do you want to be? What do you want to do with it? What are some of the trends that are happening? And then I'm going to show you some slides in terms of where do our graduates go? What do they do, right? And then who we are and how we can help you get there, okay? So for instance, our placement rate for graduates is 98%, okay? So I don't want you to be part of that 2%, right? All right. So what is public health? Public health is a variety of different things, but basically it's a set of core functions and essential services. You can see the 10 different services up there. And what's interesting is it's assessment, policy development, right? Assurance, and it just keeps rotating, right? And some of you are going to be engaging in these functions and services in a variety of different ways. For instance, you might have a passion for evaluation or policy. You may have a passion for healthcare administration and improving the quality of care. Whatever it is, public health is what you're going to be doing. It is also a government system, and as was mentioned by the dean and others, we are fortunate enough to have literally 5 stops off the light rail, the Minnesota Department of Health, and yes, it drops you off right at the front door of the Minnesota Department of Health. In addition, you'll see stuff like the CDC, USAID, World Health Organization, by the way, all of which we've had students go to, okay? So it is the government system that's not on here would be the local government system. So city government, county government, so on and so forth, but that's also part of this process as well. It is a set of beliefs. You heard from Gail talk about anti-racism, social justice, right? We believe that being healthy is a right for everyone, not a privilege. Doing community good, doing it for the herd versus individual rights. A lot of you are here today because you're interested in population health or really prevention, which is the third piece, and really making sure that we're keeping our communities healthy, safe, and we're saving money while we're doing it. This is one of my favorite. It's obviously a great career choice. We have public health professionals in a variety of different backgrounds in industries, whether you're coming from us, from a science, social science, business, agriculture, math. Yes, we do get some that studied, French and philosophy and a variety of other majors, which is I love as a career coach. In addition, you can see there's a variety of different opportunities that are expanding: violence prevention, gun safety, emergency preparedness. These are all some of the hot latest trends that we're seeing, growth opportunities in terms of public health careers. There are a lot of different sectors, we call them, or industry sectors. We have graduates that'll go into private, public, nonprofit, academia, and government. Sometimes we'll get a few folks that'll do self-employment or entrepreneurship, which is really the only one missing here. But this is something that, as a career coach, for instance, we really can work with you on what makes sense for the right environment for you. Where are you going to thrive the most? And each of these are very different. I can tell you right now that post-COVID, government and healthcare, there's a lot of burnout. And so you're seeing a lot of people transition away from one of those to go to something else, okay? Now, if they're leaving, that leaves opportunities there, right? So just keep that in mind, but right now that's kind of what we're experiencing. We have a ginormous alumni network. For those of you that went to the resource fair, hopefully you stopped by the mentor program booth. But this is an opportunity for each of you to connect with alumni based on your career passions and interests. You can see where we have kind of larger groups of alumni across the country and globally. However, 60 to 70% of our graduates do stay local, okay? So they do stay right here in Minnesota. It's a great state, right? Why would you want to leave? But we also draw a lot to Wisconsin, California, Pacific Northwest, as well as the Mid-Atlantic region. So and I should also mention that if you haven't already, I encourage you to check out the School of Public Health on LinkedIn. You can go to their school page and you can see the vastness of alumni that exist. As a career coach, I am constantly introducing students to alumni all over the world. So if that's something that is of interest to you and you want to explore, learn more about that, the Career Center is here for you. Just a sample list of many of the employers that we have relationships with, that we work with. Obviously, there's a lot more than what's just here, but just to kind of give you a breadth of the awesome sort of industry that we have, not just in our backyard, but we also have regionally and nationally. If you're interested in going internationally as well, we do help you with that, including the Center for Global Health and Social Responsibility. So definitely, there's no organization that, in my opinion, is untouchable. So we're here to help you connect with them. All right, where do our graduates go? So I know it's difficult to see, but I can assure you that we have data. If you're a data person, you love data, just reach out to us and we can give it to you. But you can see kind of like in the kind of top middle percentage employed by sector. Healthcare continues to be sort of the top industry sector. It's been that way for the past 10 years plus. Government continues to be number 2. But then you'll see kind of academia and nonprofit and for-profit kind of hang out there in the background. But average salaries, I get asked this quite a bit in terms of how much can I anticipate making. If it were up to me, you would all make 6 figures. But I'm not that rich. So the key here is that the job sector is really, really positive. It continues to be very positive. We do not anticipate any setbacks when it comes to the job market. So that goes for both MPH grads as well as MHA grads. This is also some data in terms of, okay, they go into these job sectors, but what kind of work do they actually do? And you can see that data analysis, health disparities, administration, community health, epidemiology are some of the top ones. And this data incorporates all degree programs. So data analysis is something that, whether you want to do it or not, more than likely will be part of your role. So, all right, career planning. So as you kind of embark on this journey, what we encourage you to do is get a jump on this early. Start thinking about what the next 2 years are going to look like for you. It's going to go fast. And so we want to make sure that we can meet you where you're at and get you transitioned to whatever's next for you. I've talked with some of you that I have an interest in going to the job market, some to med school, some that are looking for advanced education after this. Whatever that may be, you want to get a jump on this and start thinking about planning ahead. It is a journey versus the destination. This is kind of, as part of our Career Center, we think about how we work with you, sort of starting with what do you bring to the table, assessing your strengths, your skills, your interests. Preparation, how do I explore, what kind of opportunities can I look at, getting my resume dusted off or my CV ready to go, making sure that I'm prepared to enter whatever transition's coming next. How do I connect with these employers, with the alumni, and then how do I put that into action? And one of the things that I'll get to shortly is, as a Career Center, we're very, very, very evidence-based. What that means is we are not generalists as career coaches. We're not going to give you a general template of how a resume looks. Instead, we're going to work with each of you individually to say, you know what, based on what you're bringing to the table, here's the highest here's the best way to get the highest probability for an interview. And that includes, how do you beat AI systems when you apply for jobs? We can help you with that. So we're very, very evidence-based, what actually works, okay? And then we evaluate, how are things going? All of you, so MHA will do a residency experience. MPH, you're gonna do an applied practice experience. This is a great opportunity for you to get your feet wet, and Mercedes is gonna talk a little bit about the applied practice experience. But it's, if you go into an experience and you come out of it and say, you know what, this is not quite what I'm looking for, we help you adapt, okay? So don't feel like you gotta get it right. Some of you will. Some of you will come out with a great experience, but it may not be exactly in alignment with what you're thinking. All right, as a career center, you can see the variety of topics that we provide you, that we can provide coaching, resources, assistance with. So we have two unique parts to our office. Career development, which is some of the typical things you may think of, but we also do a lot of coaching on professional development. So if you're interested in enhancing your presentation skills, or how do you deal with conflict or stress, work-life balance. I just had a student the other day where we talked about how to balance work part-time with school, with family. Like, how do you do that? We can help you with these things as well. So there's a variety of things that we can work with you on, and like I said, you want to kind of plan ahead. Couple things to think about as you go forward on this journey. Start thinking about, what does your future look like? What inspires you? What really drives why you're here? What drives why public health for you? What would that look like? What would an ideal situation look like for you? What kind of meaningful work, what kind of impact are you going to want to have? Think about the specific experiences in your life. It could be personal, professional, it could be things that you've witnessed, whatever it may be, but what drives you? What brings you energy? We talk a lot about what fills your cup, okay? And then, what kind of impact do you want to leave? 2 years, folks. 2 years is going to go by really, really fast. And so, thinking about how can you make the most of these 2 years so that when you are ready to transition to whatever might be next, that you have the skills and you have the resources to do that, okay? Another way to think about this, you may have heard of finding your why, but what is your why, your purpose, okay? That what is your contribution and what is the impact result of that? So this is just a simple way. One of the things that we encourage you to do is write this on a Post-it note or an index card, put it next to your mirror, next to your bed, look at it each day. Continue to drive yourself toward the work that you want to do. In addition to the various things that we can help you with, we have a Canvas site that is free for all students. You're going to be getting an email from our director, Vic Masalia, who will invite you to register and log in. It's free to use. But in Canvas, you will see all different types of resources. And you can access this 24/7 anytime you want. So definitely encourage you to take advantage of that, especially if you're not able to get in touch with us for one-on-one coaching. You have some resources to get you started. We're going to be having some upcoming fall workshops. You may see some of those on the tent cards, but you'll see these in the Sphere newsletter that you'll get, the student newsletter. But we're going to do a variety of workshops throughout the fall semester on a variety of different topics. Keep an eye out for those. They all are virtual. They're all going to be Tuesdays at 12. So if you're not able to make those, don't worry. We're career coaches. We can meet with you and help you out, okay? In addition, we are also offering drop-in hours. You don't need an appointment for this. Drop-in hours we're going to have from 1 to 2 in person. And then I will be doing the virtual ones 5 to 6 p.m. So if you're working and the only time that you have available to drop in is in the evening, come see me. I'd be happy to chat with you. On our website, there is also a way to schedule appointments with us. Appointments fill up very quick with both myself. There's just 2 career coaches. So again, I encourage you to get a jump on this early. Connect with us right away. We can get a jump start on your journey going forward. You'll see our email address. That goes to both Vic and I. And then back to sort of the networking contacts. We're both on LinkedIn. We invite any and all of you to connect with us. Between the 2 of us, we have over 8,000 connections. And so we are constantly connecting people to professionals based on their field of interest. So reach out to us, connect with us on LinkedIn. If you don't have LinkedIn and you want to create one, again, that's something that we can help you with. Mercedes, you ready? Awesome.
Hello, hello. Well, he will come back. Yay. Yes, hello, hello. My name is Mercedes Teneja, and I coordinate Apply Practice. So for all of you who are MPH students, regardless of the program, every MPH student has to complete an Apply Practice. And I work with the programs, with the divisions, because Apply Practice have general, and they all have to meet the same requirements, but also different programs have their uniqueness. So yes, so that is me. I won't be here very long. So here, there we go. So 2 things that my takeaways from today are that tomorrow, Friday, tomorrow in the morning, I will be conducting a 30-minute session on Apply Practice. It's not about the process and the forms and all of that. It's an introduction to the requirement, what it is, and more importantly, like how the resources you have to start looking for sites. And this has to do with everything that Darren just mentioned, like all of the connections that we have with different organizations. Tomorrow will be about showing you where you can start finding these connections. So that's where I'm gonna be spending tomorrow. And speaking of making connections, on Thursday, October 24, many organizations will be on campus. So we have practice day, and it's an event in which organizations come here, well, Mayo building, and they will table for about 2-3 hours, and you can come and meet them, and you can see what they do to start thinking about if you can do your practice with them, but also to know who is in the network for career opportunities. And simultaneously, second-year students will be showcasing posters about their completed Apply Practices. So you get to meet second-year students. You can ask them, how did you find them? How was your experience? You see the posters. Everybody gets lunch. And then you will meet local organizations. So that is happening in October 24. And later in the spring, they have a big event, which is more towards it's Career Connect. And it's really where you're thinking about, I need a full-time job type of thing. And so we have something in the fall and something in the spring. Yeah, and that is. Thank you.
Thank you, Mercedes. All right. I mentioned this earlier, but in addition to meeting with a career coach, if there's one thing that I recommend for all of you is absolutely join the mentor program. It's award-winning, it is outstanding. The attention to detail when we go and match students with alumni or professionals in the field is extensive. So we really make sure that we look at your application, we look at the mentor's application, and we find the best match, okay? And so this is someone that can be a resource, a connection, an advocate throughout your degree program. And you can do it both years. So again, I definitely recommend that you partake in this mentorship program. And we have mentors that are all over the world. So some of it can be in person, some of it can be virtual. All right, at this point, whether it's regarding Applied Practice and Mercedes or regarding Career Services, Career Services is also hosting a workshop tomorrow at 11. I hope to see you all there. where we go in a lot more detail and give you some unique tips as you embark on this journey. But at this point, I want to turn it over to you. What questions do you have in terms of what we can do for you, services, resources, applied practice? Any questions? Yes. Correct. Yeah, so for the, how many of you are in the MHA program? All right, whole table, sweet, awesome. Yes, so what you're gonna do is what is called a administrative residency, okay? Like applied practice, what I suggest is start to think about what type of health system would be of interest to you, geographical location, okay? And then what's a good thing to do early in the fall is start to talk to alumni, former residents, even, current fellows that are there, just to kind of get a sense of what options might be available for you. So there's outstanding opportunities all over the country and internationally, by the way. So yes, so residency, and then after that, you'll have a fellowship. Some of you might go full-time job too, but fellowship after graduation. So yeah, get a jump on it early is my recommendation. So, and we can definitely help you with that. Other questions? Don't be shy. Yes.
Thank you. Are we able to stay connected with the Career Center after we finish graduation, or is it just, kind of during
yeah.
the program?
I'll pay you for that plug. One of the coolest things that we offer is, as graduates of the School of Public Health, you get lifelong career services for free, okay? And not just, here are some resources, but both Vic and myself are meeting with alumni all the time. And they're transitioning to a new level, they're transitioning jobs, they're looking to, how do I promote myself within an organization, all different types of things. So yes, you get lifelong career services, and we're here to, like I said, meet you where you're at and be a resource. So definitely utilize us. As you embark on your academic journey, keep in mind, the first, Mercedes is an alum, okay? And the first semester can be intense. And you're adapting, you're trying to figure out the method to the madness, how faculty do their thing, how classes work, readings, homework, all that kind of stuff. If you wait till the last minute to kind of start thinking about applied practice or start thinking about your career, okay, it's just gonna intensify more things. And so plan it out, be strategic, start conversations with us. We can create an action plan so that you're good to go, okay? Other questions? These are good. Any other questions? How are we doing on time?
Good.
We got a question?
Where are you? Where can you raise your hand? Who has a question?
Oh, I thought you, sorry. Yes. Yeah, so the question was, is there an opportunity to do professional headshots? Yes. Yeah, today and throughout. So today there'll be opportunities, but also you'll notice that communications and others will put through the Sphere newsletter that they're going to do photo shoots. Honestly, we do it every single time. So we have, tons of photo opportunities that exist. Later in September. Okay. Thanks for the clarification, Jen. So later in September, you'll see an announcement for professional photos. Okay. Don't go to glamour shots. You don't have to do that. But we do offer you those opportunities. So, yeah, great question. Any other questions? Yes. Yeah, do you want to take this one? Okay, repeat the question.
So the question is if an internship can count towards an applied practice. And if it's within public health settings, most likely yes. Also, the person who supervises you at the internship needs to be willing to be a preceptor. So I will go into that tomorrow, but since you're here, so students can fulfill the requirement if they are employed in a public health setting, if they are pursuing an internship in a public health setting, and also throughout, ongoing, we receive just applied practice standalone opportunities, which are more of a shorter commitment time. But yes. Yeah.
Good question.
Any other question, or are we at time?
Anything else you need to know? Make sure you get that resume ready.
We have microphones. Please wait before you ask.
Just a more logistical question. Where's your office?
Where are we located? Yes. We are located physically in the Mayo building, 3rd floor, right across from the dean's office and the Student Services Center. Okay? But we also are available virtually. And so, and I should mention, like I said, we can be very, very, very flexible.
Virtual or in person?
I forgot about the microphone. Hopefully they could hear me. Just to repeat, we're in the Mayo building, 3rd floor, in the Student Services office. We're also available virtually. You know, if you need to meet with us in the evening, just reach out to us. You know, we're flexible. So we're here for you. And, you know, we're excited to work with all of you. We're excited to help you transition and continue to maintain that 98% placement rate. So, all right. Looks like we're looking to transition. So thank you so much. Enjoy the rest of your day, folks.
All right, we're just going to take a few minutes and we're going to swap rooms. And so, or no, sorry, you're going to stay where you're at. I'm sorry. The presenters are going to swap rooms. So just take a few minutes. We'll have a 10-minute break. You can chat at your tables. You can take a restroom break. You can grab the last-minute fruit that's here. And we will start back up around 11:10. Thank you. Or 11:15.